BHRT, bioidentical hormone replacement, is the first course of action for many of the physicians with their patients with bone health. So can you explain to us the hormones that are being prescribed, why they're prescribed, what's prescribed?
There's three things we can do. One, we can stimulate the body to produce new bones. Two, we can reduce the body from erosion of your bones. Or three, how can I build the muscle mass around the bones so that adversity doesn't crack on you? All three things can be affected by hormone replacement therapy. Estrogens, particularly estradiol, at the doses between 60 to 110, has shown in clinical trials that level of hormones is effective to prevent from osteoporosis. We need to have estrogens from stopping the body from breaking down the bones. Progesterone has osteoblast activity, so being progesterone on board can also help you rebuild new bones. Both of them as a combination is a great thing to have. Stop the erosion, help produce new bones. Testosterone help increase the muscle mass around the bones so that even if it's not strong enough, it can withstand a lot of pressure before it cracks up open for you. All three hormones are very critical in making sure that the bones are taking care of it. That's just the hormones, right? The main thing you need is the nutrients, because bone is so many nutrients inside, goes inside.
Okay, so estrogen's building, progesterone is stopping bone breakdown, and testosterone is building or supporting muscle tissue, which is then in turn going to support building bones.
That's right.
How do we figure out the dosing when it comes to the prescription?
All the clinical trials that have been done so far, they've only done trials on estrogens only. That's the only thing we can go by today. What levels of estrogen do we want to achieve to have the best performance from not just the bone health, but also for heart health and mental health? We have to make sure the estradiol levels are in proper range, and we usually measure the blood for that ranges and the levels between 60 to 110. Based on that estradiol levels, we know how much progesterone we need and how much testosterone we need. Now, testosterone in women is not approved by FDA for women's health. The only way they can get testosterone is through compounding pharmacies and the doctor prescribing those testosterone at low dosages. And they can make it a low dose or a high dose. More is not better. I tell this all the time to people. Just because a little bit is good for you, more is going to be better for you. The body, if you give too much of a good thing, it has to process that good thing and try to figure out what to do with it. Giving the right amount is that critical to making sure the body doesn't have to work any extra harder. I'd rather give a little less than a little more. A little less is the body's deprived, but it's not working overly hard.
Why are there not more studies done on hormones?
The study that I'm referring to was done in 1993, so it was a long time ago. Since then, there were two studies being done. The study they thought it's going to come out really good. It was a multi-center, massive study. It's called the Women's Health Initiative. That study kind of backfired them because they used the wrong medicine. They did not use human identical estrogens. It was already FDA approved. Instead, they used horse's urine estrogen, and they use a synthetic form of progesterone, not a natural human progesterone, even though they're both been FDA approved. FDA has approved both the bioidentical hormones and the synthetic ones. For the study, they chose a synthetic hormone to study on instead of the natural hormone that's been FDA approved also. That was unfortunate. I wish they choose the other hormone because we'll have good data today to talk about. The interesting part about that study was that 98% of the women had no problem. But the 2% of the women that did have problem had a lot more cases of breast cancer, heart disease. Of course, the researchers got scared and then they stopped the study. They put the press release out there that, hey, hormones are cancer-causing agents, so she stopped taking it altogether completely. There's two things that was wrong with it. One, they choose the wrong hormones. The second, the hormones were all given orally. Our body does not produce the hormones in the stomach. Our body produces hormones in the ovaries or the testes in the men, right? And so we want to make sure that the hormones are endogenously produced. So whatever we can do to stimulate endogenous production of hormones is more critical than taking it by mouth orally, because that doesn't reflect what the hormone is supposed to be. And of course, if it's in the wrong part of the body is going to react to it. Every single thing that every body has is in the right place at the right time. If you see an eye, something's coming on your elbows, guess what? It's not the right thing to do for the body, so it's not going to react differently. When you give hormones, when you give some medications that is not in the right place, the body just reacts to it differently. And that's what the issue was.
And that Women's Health Initiative took away hormones from women in 2003. And the functional medicine physicians that I've interviewed said there was an increase in fractures. I had heard also that it was Premarin that was used, wrong form, and that it was oral estrogen. But we do take progesterone orally when we're on BHRT, right?
The progesterone is not supposed to be taken orally, but Oral progesterone in menopausal patients, it has a dual action. Progesterone gets metabolized to L-pregnenolone, which actually helps you calm down, helps you fall asleep better, and has a more calming effect. And whatever is not metabolized ends up happening to be available to the rest of the body for it to act as a progesterone to help regulate estradiol levels. But estradiols, testosterone, it's never ever given orally.
If we don't have a study since 1993, the one that they tried to do in 2003 was flawed. I still am so curious as to why we're not doing more studies. Most studies are done on men, right? Because women have hormones and it's very challenging. You try to hold everything constant except for one movable part. So maybe it's just we're trying to hold a moonbeam in our hand that we really can't figure out. Yet we're prescribing these medications. So you do believe that these are safe for women to take?
The safety of the hormones does not come from the hormones itself. So I just want to make sure people understand that part. Hormones are actually dangerous, but in the right dosage form, in the right amount in your body, in the right place, it can be angel of life. Angel of life and angel of death isn't just one hormone. The difference between those two things is where is it, how much is it, and in what form is it. If you can identify those three issues, I think we have a better chance of having all the benefits of the hormones with very little side effects. There's not going to be zero side effects, but we can minimize as little as possible. And that's the ultimate goal for us. If you give one particular hormone and not in a balanced fashion, that particular hormone can actually be harmful to you. So if you give too much of estrogen and no progesterone, no testosterone, no DHEA, yeah, it will be very harmful to you. Same thing, if you give too much of testosterone, but no progesterone, no DHEA, no estrogens, that can be harmful to you. A lot of side effects for that. So giving the hormones in a balanced fashion is what we advocate. Now, there's a study done in France. It was a 9-year cohort study. That means they just looked back about 3,100 women in the study. In Europe, they have bioidentical estradiol and progesterone both available topically. And so they were giving them both the hormones topically. But they found out that over 8 or 9 years of period, that the relative risk for breast cancer in those patient population was 0.98. So let me give you some reference about the numbers. So if you're an 18-year-old girl with no risk factors, your relative risk for breast cancer is 1.18. Those women taking hormones over 9 years, their risk reduced to 0.98. As long as you give the hormones in a balanced fashion, they were topicals. If you do that, the risk for breast cancer actually dropped below an 18-year-old girl without any risk factors. This is huge. Again, it was a cohort study, so it's not like a double-blind placebo-controlled trial, which is the gold standard in the United States. The question that you asked me earlier is why no more studies not done yet? Because keep in mind, the Women's Health Initiative was funded by a pharma company, the one that makes the drugs. If you're not going to benefit from a bioidentical hormones, guess what? The only person that can do the study is the government. But the government has no incentive because it's not centralized without universal health care, so they have no incentive of finding solution for the American citizens.
If you enjoyed this clip from Stronger Bones Lifestyle, be sure to check out the next video or dive into the full podcast episode. Before you go, hit that subscribe button so you don't miss a thing. Thanks for watching, and I'll see you in the next video.